In the midst of resuscitating the economy, a wide range of leaders in government, labour, business and civil society partners are supporting the upcoming Vooma Vaccination Weekend. Joining us now is Cas Coovadia, who is CEO of BUSA and before say Chair of Communications, Stakeholder and Advocacy Workstream. A very good afternoon to you, Mr. Coovadia. Thanks very much for joining us here on SABC News.
Good afternoon. Thanks for having me.
You're most welcome. Let's talk about the success rate of the Vooma Vaccination Weekend since they started. How's the rollout been then so far?
I'm afraid I don't have those details. I mean, the Vooma Vaccination Weekend has been organized by the Department of Health, and I guess we'll get details of how many people have vaccinated tomorrow as they start collating those. The weather has been a bit of a dampener, but we've been, as business and some parts of labor and other parts of civil society, we've been pushing quite hard to encourage people to vaccinate because it's becoming increasingly clear, not that it wasn't clear before, but it's becoming increasingly clear that vaccination is the most effective weapon against the virus. So we'll get the figures in tomorrow. Yeah. But we've been backing government up in just encouraging people to go and encouraging people to vaccinate.
All right, I don't expect you to have today's details necessarily. It would have been great if you did have them. But can we talk about the past? The Vooma Vaccination Weekends have been ongoing. So certainly part of my question did include how it's been going. So maybe you can give me an indication of how it's been going in the past. Let's forget this weekend then for now.
Yeah, so I think over the couple of weekends that we've had, we probably vaccinated about 250,000 people, which is far not optimal. It would be great if we could do much more than that. Yeah. But it's probably 250,000 people that we wouldn't have vaccinated otherwise. One of the things that, we encouraging churches to have vaccination sites. We're encouraging other centers where communities gather to have vaccination sites, because one of the issues has been that we're not sufficiently taking vaccines to the people, and the Vooma weekend is to try and actually have sites up and running where people are, so that they don't have to travel. So I think that this has helped to an extent, but I think that the other thing we've been pushing as business is some sort of mandatory vaccination, and the sort of momentum for mandatory vaccination seems to be increasing. Yeah,
we understand that the Education Department has in fact joined the Vooma vaccination campaign, and I understand that part of that role actually includes opening up schools and making them Vooma vaccination sites. Is that safe? I mean, given the fact that during elections, I seem to remember that schools were shut down to people coming onto campuses due to the fact that there was a concern that there would be spread of the coronavirus. And now to say that you're opening up schools for people to come in and to get vaccinated seems to defeat the purpose as to why during the time of elections, people were not allowed onto school premises. I mean, it just seems that it's two different things going on here, and the reasoning I don't quite understand what's going on there. I mean, can you maybe explain that?
Well, I would think that if schools are being used as vaccination sites, then there'd be appropriate protocols in place, there'd be appropriate social distancing in place, there'd be vaccination sites. All vaccination sites need to go through some fairly stringent criteria that the Department of Health needs to be happy with. So I think to allow people onto school premises for things other than vaccination is very different to allowing people onto school premises for vaccination purposes, because protocols would be in place. Department of Health would be satisfied that the school is ready for some such vaccinations, that there are sufficient personnel in place, skilled and experienced personnel in place to ensure that people do social distance, and that to ensure that it's used only for vaccination. So I think the two are very different sets of circumstances, and every vaccination site that I've been to, it's quite clear that it's been set up in a way that actually ensures that we protect people from actually being infected any further.
Yeah, you mentioned the issue of bringing the vaccine to the people. What views are you getting from people that are coming out, and I'll say late, to vaccinate, as to why they actually took so long to come and take the vaccine? I mean, I don't imagine that you have people, recording people talking, when they get to those sites. But I wonder if you've had any sort of interaction with the people who are coming to those Vooma vaccination sites, who perhaps are explaining why they took so long, and was that one of the major issues, the fact that the vaccines were not being brought to the people?
I think one of the issues undoubtedly was that vaccines aren't being brought to the people, and that's why the Department of Health, not only during Vooma weekend, but even at other times, has jacked up mobile vaccination sites and are actually using mobile vaccination sites. I think other reasons are, one, that there's just a lot of fake news and lots of debate floating around about vaccines, and people are not sure that vaccines are safe and so on. But I think as we publicize more, and as we've had more publicity around the safety of vaccines, the efficacy of vaccines, I think Omicron has, to a certain extent, also added a spurt to vaccinations, because people have seen the impact of Omicron and the fact that we, in the last week or so, we've been doubling infections virtually every day. And I think that sort of spurred people on to say, hold on, this thing is serious. We do need to vaccinate. I think the sort of vaccine naysayers, those who are saying that vaccines are bad and so on, I think those are in the minority. I think the majority is lack of appropriate communication, having to travel distances to go and get vaccinated, not having the appropriate information, and being, to a certain extent, confused by fake news that's out there. So I think it's absolutely critical that we consistently communicate the correct facts, or communicate the facts. We consistently emphasize the need for vaccination, and we consistently say that if we want to get back to some semblance of normality, the vaccine and non-medical health protocols are the most effective way to do so.
All right, thanks very much for giving us your time. Cas Coovadia, CEO of BUSA, and before I say chair of communication.